In today's session, we will learn some important rules which are the foundation of good manufacturing technicians' skill sets. There are a few set of rules that come under GMP and GDP compliance. From an experienced manufacturing technician, if you remember those rules and understand compliance part behind them, you can build a habit of a good manufacturing technician, and it will help you grow in your career on merit basis. These rules, when followed, would help you avoid errors and deviations automatically. First thing you need to remember under the dose for GDP, as a manufacturing associate, is that always do what is written and write what you have done while working in pharmaceutical companies. This will allow you to be in the discipline of executing tasks as per pre-approved procedures and FDA guidance documents. Moreover, having a practice of recording/writing your each operation ensures traceability of your operation performed during drug manufacturing. Traceability is another key word. You need to remember its significance. Now, by making a thumb rule of write what you have done and do what is written, you are fulfilling two compliance parts. One part is that you are creating traceability required by the FDA. Writing what you have done is creating traceability, and do what is written means you are following procedures as they are written. For an example, if a procedure is telling you to walk through a certain area and store a drug product in a refrigerator, you need to follow the same path and instructions, as it is no deviations allowed, and after completion of the task you must ask yourself, have you created traceability? Which means if you are about to forget to enter your work in the refrigerator log, your write what you have done reminder would tell you that this must have a traceability and a log should be there, and I must fill before leaving. This is a principle that you will establish and learn bigger compliance parts. Staying on top of your GDP practices, you must always correct your errors using good documentation practices such as not using pencil to begin with, any whitener, any erasers, recording data on sticky note, and crossover writings. This is a big no-no. In fact, these things shall be around at a facility. Instead, you should clearly mark your error and cross with a single line in the middle. Signatures must be recorded in real time, no photocopy of signatures allowed. Correct entry and reason for error must be given with an annotation and a proper footnote. Clear examples of GDP are explained and demonstrated in GDP training session. Now, we will discuss some do's that come under quality management compliance. To fulfill this, always notify supervisor of any deviations when they occur or about any potential deviation that you may be able to foresee. Under terminologies training session, we have discussed details of what a deviation is. According to the procedures, deviations are conveyed at the time of findings to your supervisor. Further, these deviations are documented, initiated, reviewed, investigated, and approved on timely basis. This is an FDA requirement to document a deviation and its proper closure after root cause identification. When you convey the deviation done by you or by someone else on the floor, you must not try to hide, but inform the supervisor right away so the procedure of deviation could become right away. If not, any deviation will surface up because all the work will be reviewed again. In your best interest, see something, say something. Now, most excitingly, these do's would set up great compliance attitude within any manufacturing technician if adopted and remembered. Let's move on and learn those points. Always check calibration dates, preventive maintenance date, qualification due date of instruments, equipments, before operating or using for production purposes. Let me give you a real-time example. Once facility department failed to perform calibration on an equipment which was supposed to generate air pressure. These type of machines require regular preventive maintenance and calibration, because all the motors inside run on certain RPM rounds per minute, and this can go off due to constant heavy vibration and heat. Thus, if regular calibrations are not done, those machines are not workable to their full capacity. This can get a manufacturing technician stuck in the middle of production, with product in hands and a broken machine in sight. All because a manufacturing technician failed to check that the calibration was not performed and should not have been used. But a good manufacturing technician will not operate a machine for any operation given without checking calibration date. This will save you half your pains as a manufacturing technician at work. Hello again, you cannot ignore these do's if you want to avoid big mistakes. Trust me, big mistakes, where you might have to toss the drug lot away. And we will get to it in a minute. Getting back to your do's, always check manufacturing date, packaging date, expiry date. Wait a minute, expiry date. Yes, I repeated it, and you want to keep it on top. Moreover, quantity, signature in the label of raw materials issued for manufacturing operations, such as buffer preparation or any chemical solution preparations. This industry have seen many incidents when not just one, multiple people failed to check expiration on critical raw material. In some cases, drug cannot be released in the market, and you can figure out the rest. It's not rocket science. Without these do's, drug can be easily contaminated, most likely regardless of how much we produce. There is no guarantee that drug will ever reach the market. Yes, that is true. Because it will catch impurities and germs from humans. Humans are the biggest source of contamination. We have learnt that from the recent pandemic. To prevent human-generated contamination, need to adhere to and practice strict gowning behavior. In a different training session, gowning is explained in simple manner. The company you will go and work for will train you again. So practice our training and try to understand how to keep and maintain cleanliness at every step of the way and increase your understanding of different type of gowns and their importance. Always check your gown before entering the manufacturing area to ensure your body is completely covered and you followed the correct sequence of gowning in change room and completed hand sanitization. Rule of thumb: while in clean room area on the manufacturing floor, be sure to spray alcohol on your gloves for extra precautions and let them air dry, as any bacteria or germs will die with the use of alcohol. This is a standard practice for manufacturing technicians. While in a clean room, you must regularly keep sanitizing your hand with alcohol and let their gloves dry with air. This practice is repeated 15 to 20 minutes while manufacturing operations are going. There are certain do not do things that you must be aware of. At times you may lose your job if you do certain things. Let's learn more about these don'ts. As a manufacturing associate, you should never record any operations or mark any signatures in back date or future date. This can cause to severe compliance issue and data integrity concern. FDA takes data integrity seriously. This is simply considered data manipulation and the recording is not in real time. Therefore, record all operation in current date in real time. Complete the entry as soon as operation is completed. Backdate entries, or entries that were not made in real time, these entries are not allowed and are against Alcoa principle. This is seen as a data integrity issue by the FDA and other regulatory bodies, and many companies are given penalties and fines across the globe. Never hide your errors from your supervisors. Biotech industry understands that we humans are subjected to perform manual errors. They expect you to inform them at the time of an error. This part of company's process improvement and also part of quality management system. Hello again. These don'ts will keep you in training compliance for yourself and your company, and this is an important FDA requirements. You must not perform any operation if you are not trained. That means all responsibilities of a manufacturing technician, from cleaning a room to drug manufacturing, they are all documented and created as procedures and work instructions. Getting trained on these procedures and work instructions is your responsibility. As a manufacturing associate, you should only operate any instrument, equipment, operation, process, facility, anything. Only once your on-the-job training is completed and recorded. This ensures that you are properly trained on a process, on an equipment, before actually operating it, and ensures safety of other technicians. In some cases, for example, let's say, although you have industry experience of handling a particular machine in general, but at your new company, this model can be slightly different and may operate differently, unless you are trained by your employer, and your qualification is marked completed. In your training records, you must not touch any operations period. Also, this ensures safety of patients by avoiding any deviations. For an example, if your supervisor or another manufacturing technician asks you to help them in any activity, which you are not trained by the company officially, your answer should be this politely, that I am not trained on this procedure, and would like to maintain my training in compliance. This would save you a lot of trouble and a great escape from non-compliance. This one can also create critical compliance issues. As you can see, this don't is related with raw data and or metadata. As the name suggests, raw data is a data taken from an equipment, a reading, a measure, reading from a weighing balance. All this is critical. For an example, you have to mix two chemicals of certain weights and you weighed them on a balance. This balance should print out how much the weight was. Otherwise, how would we know how much you added if it is not recorded with dual control? And raw data is also not present according to the rule of thumb. If it is not recorded, it never happened. With this understanding, I want to tell you a trick that you can remember any entries that you come across that you believe critical and raw data is important, and not present the readings must be under dual control. One manufacturing operator will sign the operation and another will verify the accuracy of the entry with his signature. If we do that, we are incompliant. As a manufacturing associate, you also don't transcribe data on sticky notes, hand gloves, PF paper, or temporary documents. We should always record information, data, or accurate reading in logbooks and production records. If you need to do calculations, there are calculators in the clean room for help. Every other data should go on appropriate documents to ensure GMP compliance and is written in company procedure. Thank you for being with us this far. See you in next class.